Good afternoon, everyone. Welcome to Impact Hour. It's Thursday. So good to be here today and see so many familiar faces. I am just thrilled with our presenter this week. We have Jay Lawrence Dixon, and Jay is a DSW candidate at the University of Walden, but y'all probably know them as the roving social worker. And Jay is going to talk to us today about travel social work as a career option, and talk about their observations on consistent themes in social work all across the country and in different contexts. And I'm also interested to hear from Jay regarding using social media to really get the word out there in terms of what we do as social workers in different areas. So let's just jump right in, and here's Jay.
Hello, thank you for having me. Um, I don't know, I got way too many accolades from Jennifer. She's like, "Oh, I love this." So now I don't know how to deal with that. I'm sorry. So I have my little stress ball, a little anxious. I keep squeezing that. But thank you for inviting me. I was told who's on the guest list, and some of you all already private messaged me. So hi guys. Um, I also hear there's students from OSU. I live in Columbus sometimes, and University of Michigan. My family's from Michigan. Hi. So thank you for representing. Today, I would like to just have a conversation. I'm not real big on PowerPoint slides. They're great, but I'm the type of person who likes to have a conversation. And if any of you have ever interacted with me on social media like Twitter or Instagram or listened to my podcast, you'll know that that's just kind of how I roll. I like to have conversations. I also really like to talk about social work, especially travel social work, because it's not a well-known like subfield. So I have been a travel social worker since 2017. I literally just fell into it. I've written about it. I've talked about it a little bit. But what had happened is I was in a job. I was a director of a department, a brand new department in home health, and it really wasn't working out for me. The pay was really low. Um, my husband actually had just lost his job. So I was trying to figure out what to do next. And a recruiter found me on, I forget what site, like Indeed or something, and reached out to me and said, "Hey, I have this job that pays this amount of money. And it's in this great place called, oh, thank you, Jonathan. Sorry, my mic was bumping around. Um, so anyway, it was this great opportunity to move to northern Arizona in Prescott to work in a PHP, which I really, really wanted to do. I wanted to get out of medical social work and back into mental health because that's just my favorite part of social work is being a therapist. So I did that. It didn't quite work out long term. It was supposed to be a temp to perm position, and that didn't work out. However, I learned about traveling. I'm like, oh, this is really cool. And there's a lot of opportunities to do a lot of different things. So I ended up hooking up with a recruiter from AB Staffing, which is whom I still work for, and started traveling and taking on several different types of work. Now, travelers are often medical based, so case management, working in ERs. Um, I was actually in a very large ER level 1 trauma center in Phoenix for a while on contract. I ended up doing long-term care contract, but I've also done 3 behavioral health contracts, which they're a little bit rarer. I've been able to work with indigenous populations, very rural populations, and then I've been in a huge city. I mean, Phoenix is like the 5th or 6th largest city, I think, in the U.S. still. So it's all over the place, all over the country. I've been in Minnesota in one of the worst winters they had in 20 years, and I'm currently in Montana. Um, Travel work, I had a couple of questions prior to starting this. So some of the questions are like, are you self-funded? I'm not quite sure what that means, but I will say you do have to have a little bit of money to get going on this. It's costly. You have to maintain two households. You have to have the money to travel. Some contracts will reimburse you like $500 for moving, but that usually isn't enough to cover. So yes, there is a little bit of self-funding in that sense. It can be really expensive too because you are maintaining two households. In my case, sometimes it was me at a contract site, and then my family is like back in Columbus, and so I'm paying for double rent, all those things. That's part of traveling. Let's see here. What are the biggest challenges of this work? I would say the biggest challenges are self-care for me personally. And then the second part is cultural awareness. I know it goes by a lot of different names. Not all of it means the same thing, but cultural competency, cultural awareness, um, that's a big issue because you're jumping from different states, different populations, really urban, really rural. For me, indigenous, I like to do indigenous contracts. And there is no pan indigenous identity. Each tribe is very different. There are similarities, yes, but each tribe is very, very different. And their relationship with travelers can also be very not always great. They don't always have great experiences. So you're walking in like that with that issue. So that's like the second biggest challenge is to make sure that I am capable enough and that I am meeting our code of ethics when I go to each site. So am I able to perform this job? Can I do case management? Yeah, I've done a lot of case management. So my medical social work jobs weren't too hard. Am I a good therapist? Sometimes, yeah. Do I always have the skills I need for that particular population? No, no, we don't know everything. That's part of continuing education. That's part of having good supervision or consultation. That's part of having friends in other parts of the field who know more about things that you don't. So I've really relied on those connections to make sure that I'm learning or looking at what's going to work best for the people I'm with. And then the self care part is sometimes I'm alone for weeks to months. And um, I think the pandemic has showed us all kind of what happens with that being alone. So prior to the pandemic hitting, 1 year of my contracts, I was often alone. My family was back in Ohio, and I was in um, Arizona, Montana, and Minnesota that year. And so being alone for long periods of time can get to you. One thing that I noticed is if someone just like patted me on the shoulder or my arm, like I was really aware of being touched by anyone. It's appropriate touch, but just like that, oh wow, I haven't been hugged. And then you start thinking, when is the last time I've been hugged by someone? And can I ask someone for a hug or is that weird? Like those are the things you kind of run into. And then there's other issues with touch and being away from your partner and those types of things. So self care can get really difficult because then I also take really rural contracts and getting my hair done now becomes a process. I have to drive 4 to 6 hours one way to find a stylist, or I have to fly home. Medical care can become an issue. Even in Minnesota, I was still pretty rural, so I had to drive an hour one way just to see a chiropractor. And any specialty care was about 2.5 hours away. Where I am now, it's about 4.5 to 5 hours away to get specialty care. If the Canadian border were open, their largest city is actually closer than the nearest US city. So it's getting supplies, food. So I have a lot of food allergies, which is a big deal when you're trying to eat healthy and, have good mental health and physical well being. And I can't get food up here. So I rely very heavily on delivery stuff. Or I have to drive 4 to 5 hours one way and stock up like it's the apocalypse. Now, once again, we're all kind of doing this in the pandemic. So What I'm saying maybe isn't that surprising anymore, but that's how I've lived for the last couple of years. Um, it can get expensive to fly home. Sometimes I do just fly home for doctor's appointments. I actually have a dentist in Ohio that I go see. So I fly out there instead of trying to find someone local. So that's a challenge, and that's self care. Um, so isolation can be an issue. So make friends. I've made a lot of traveler friends, nursing and social work. Um, the next question. Where do I see myself in 10 years? I don't really know. I hope I'll have my doctorate done. Um, my chair actually gets on me about this a lot. Every time we talk, and we talk like every other week. Well, what are you going to do in 10 years? I'm like, well, hopefully I'll be a consultant making like $500,000 a year. That would be nice. That's where I'd like to be in 10 years. I don't know if that's actually going to happen um, because I like to do a lot of different things. And I, happiness isn't money. So I will pick jobs and I will pick, um, I'll make choices based on not only my happiness, but also my son's. He's 5, and my partner, who is actually in school and hopes to have an MSW one day. So a lot of my choices are based on that too. But in 10 years, I hope to be a little more settled. I don't know if I'll still be traveling as much. I would definitely like to be a consultant, and that would probably have a bit of traveling in it. Um, I'd like to be financially stable. I think we all would. I'd like to pay off my student loans that are accruing. Um, but no, I'm really open to whatever is needed and whatever makes me happy. And that's how it's been for a long time. How has the pandemic affected my work? Well, I'm working from home right now because of the pandemic. I'm not quarantined, I'm isolated. My family got put on partial quarantine due to coming in contact with someone who was sick. And my partner and I are still working in the schools locally. So it was just kind of a matter of time. So we have stuff like that. The school shuts down. Lots of people are put on quarantine. Lots of people are sick. And so it's just trying to balance out how can we continue to help the community. Um, I actually had one of my coworkers call my partner earlier today and ask if we needed any groceries that she'd go pick them up for us because we can't really leave the house. So it's really, really simple things. Like we don't have a washer and dryer here. So we have to go to laundromat. But now we can't leave the house for 2 weeks. So we're going to have a lot of laundry. Thankfully, I think we have enough clothes. But it's little things like that to big things like I can't go home right now. Medical care is very scarce right now. Supplies might run low. Um, as far as my job, I'm a contractor. So if things get cut, contractors are usually the first. So I always have to be aware that, my contract's supposed to be for the rest of the year. I don't know. It could change. And there has to be a certain level of flexibility about that. I'm always talking to my recruiter and just saying, hey, are you keeping an eye out and stuff? And she's like, absolutely, of course. Just in case. I don't want to leave. I don't want to leave this contract. But as a contractor, you have to be very aware it's a business. And when there's no money or they can't keep you on, they're going to cut you and try to keep their employees first. And that's okay. It's no hard feelings. Um, so, yeah, the pandemic's made things weird. It has not cut out jobs. I think there's always an ebb and flow to the job market in this. And I watch it just out of curiosity. I kind of want to see where the jobs are. So, yeah, there's been a lot more medical stuff. And there's been some COVID specific jobs. There has been more remote jobs in the last 6 months for travelers, which is newer. But overall, things are kind of the same. I would guess the economy is going to damage this career more than COVID will. So if the economy collapses, they saw this in 2008 with travel nursing, so will our jobs. Hospitals can't afford to have travelers. We're expensive. Um, why did you start your podcast? I started my podcast because Jonathan had a podcast and I was curious as to why he would do that. I am not kidding. I would like all these people had these podcasts and I'm like, I don't even really listen to podcasts. let's just try this. And people seemed to like it. And it kind of gave me, Jonathan just said me too. I had no idea. That's hilarious. Um, it gave me an outlet to talk about stuff that people weren't always talking about. And if they were, I didn't think they were, or I didn't think people were hearing them, or it was only in like one platform or in one way. And so I just wanted to add to that conversation. I mean, I'm queer, I'm in an interracial marriage, I have a biracial child, um, I have all these other identities that are kind of going on. And for whatever reason, at least when I started, it felt like there weren't as many social workers out there saying those same things. And I've gotten a lot of feedback from students, from social workers in any level of their career saying, I haven't seen another social worker that's like you, that talks like you, that is talking about these issues. It's nice to see a queer social worker, a non-binary social worker. I've gotten that a couple times. Like I felt like I didn't exist, that we didn't exist. So that always makes me really happy when I get those private messages on like Instagram, or I get an email or something where people's like, wow, thank you. This is so interesting. It's given me a lot to think about. So yeah, the podcast was just totally, no, let's see what happens. And I have fun. Um, what have you learned as a roving social worker that you think is unique to social work or to travel social work, and what lessons can be universally applied? I think the flexibility is a big deal. And I also think understanding that social work really is micro, meso, and macro at any given time. We might be direct service providers, so doing a lot of micro work through therapy, case management, all the different things where we're just working with people directly. But at the same time, I do a lot of meso work. So at the agency level, the places I work, I tend to try to add to it and not take away. So, for example, I've helped create new programs at places that I work short time. I updated like training materials or resource materials. Like when I worked in the hospital in Phoenix, I'd lived in Phoenix for almost 10 years, so I knew the behavioral health system pretty well. There had been some changes, but I knew some of the basic stuff. They didn't. So I added a whole section and explained to them certain processes and how to get things done quicker. My current site, I actually am writing their entire policy and procedure manual, which is killing me. And um, I helped start up the behavioral health side of telehealth. So I was the first one doing it, the first one pushing it. I'm doing all the policy and procedure with some of our physicians on that too, to make sure things are more standardized, and doing workflows. So that's meso. And then macro is I talk about all this and I make it known. You know, I throw up photos on Instagram like, hey, this is what I'm doing. I have hopefully more discussions and arguments on Twitter. Those happen too. But I try to talk about these issues. I do have a Facebook, but it's not really public. Uh, but those conversations live there too. I just tend to use that platform less. I am in Facebook groups though, so I will pop up there. And of course, in the podcast. Um, that's more of that macro level. And then if I get opportunities to write for someone or do a speaking engagement or show up in someone's classroom for 45 minutes, like I take those opportunities to do this work because this is part of giving back in social work. This is part of what we're supposed to be doing, is that volunteering, or however you want to frame that. So I really enjoy this because then we can have those conversations. Some of those conversations in the classroom are, don't accept $20 an hour with an MSW. Don't. We're worth more than that. And I get pushback on that. Know your worth. And I actually was having that conversation earlier this morning that I've been called out on that. Well, we don't do this for the money. I work for money. And I think we are undervalued for all of our skills. And we need to take time to educate people on what we do and what we don't do, and that we have a lot of subspecialties. So not all social workers are the same. So I enjoy going to classrooms to talk about that. I enjoy having conversations about the DSM and other things that aren't as popular in mental health. I enjoy reading people's tweets and being on listservs and just reading all this wonderful information, um, and then bringing it out. Well, another question. What advice do you have for social workers who are thinking about having a presence on Twitter or other social media platforms? So you'll find a lot of really cool people out there who will become your friends. If you're lucky, some might even become your mentor. I'm lucky, I actually have two mentors who have really helped me personally and professionally. And I originally met them through Twitter. And then that relationship just kept going. And then you'll meet people on social media who really just want to harm you and cause problems. And so you have to balance that. The more you say, the more likely people are to interact with you. And are you in a space to do that? Are you physically and mentally able to deal with some of that stress? So, good example is over the summer, I actually deactivated some of my social media accounts because I didn't have the space. I was doing a lot of training, I was traveling, I wanted to spend more time with my family. I think the pandemic was really starting to get to me, and I just turned it off for a while. And that's okay too. People missed me. Yeah, I got some messages on that. They're like, "Are you coming back? What's going on?" And I'm like, I'm fine. I just need some space." But I think social media, it has so much power, and it has for a long time, to do a lot of good and to spread a lot of good information as much as misinformation. So countering negative stereotypes of social workers, like seeing those articles, social worker did this terrible thing, and then you actually read the article and they're not a social worker, but that's the title. So, you can report that to the NASW and they'll get right on that so that it's either retracted or corrected or whatever. Um, it's a great way to find a community. So if you're a really rural social worker, or I don't know, you're living in the middle of a pandemic and you don't get to really see people as much, everything is now Zoom. Social media is a really great way to make those connections. And I think the people I've met, not only their knowledge, but their kindness has been overwhelming. And it's sometimes exactly what I needed. I've had people send me gifts, who've become my friends. And I'm not saying send me gifts, don't. Just I've sent out stuff. I've sent out like holiday cards. I put, who wants a holiday card? I love sending those things out. So it's really interesting. But then again, social media helps us talk about the difficult stuff that we may not see in mainstream media, though I think we are seeing a lot of it right now. Um, we get to talk about how is social work specific. So how do we engage in social justice in an ethical way? How do we do it in our daily life? How are we self-reflective? How are we taking care of ourselves? That's some more radical things that aren't really radical. How do we talk about human rights? How do we talk about politics? And talking about politics right now is really hard. Social media has been a nice platform for me. And I like visual stuff. So Instagram, I've had Instagram forever. I started the travel social work one, so it's travel_MSW. I try to keep that the same across platforms, where not only am I able to put up pictures of where I'm at or what I'm doing, but I've also been adding some self-care stuff, some videos, and trying to make it a little nicer looking than just random pictures all the time. Um, Twitter, like I said, it's a great place to find community. And then Facebook groups or other groups are good to get information, to connect with people in your area. So let's see here. I'm looking at the chat. Oh, okay, there's my article.
Jay, we had a question regarding licensure in different states and how does that work?
Oh, It's terrible. It's absolutely awful. No one agrees on everything. Everyone wants your money. Like that's the takeaway. No. So I have been licensed in 4 jurisdictions, so 4 states. And I say jurisdictions because there's actually 50, I think there's 55 licensing boards in the United States. That's including like Puerto Rico and Guam and I forget the other areas. So jurisdiction. Each each one has very different requirements for getting a certain license. So like in Arizona, you need, I think it's like 3,200 hours and 1,600 to get your LCSW after you test. And then Ohio is like 1,800 and 3,200 total, but you need 110 hours of supervision. And then Minnesota's 4,000 hours total. And then Montana only had one license for like ever, which is really weird. And then Minnesota has 4 licenses. So like it just, this is how it's going on in my mind. Like, what do you do? What do you do? So for me, before I took travel jobs, before I even start looking for jobs, I look at the licensing board. How much of a mess is this going to be? And you can tell on the website, kind of. Like they'll give you some time frames. And if the time frame is like 12 weeks, or you need to do 60 extra hours of CEs in order to even get this license, it may not be worth going to that state, or at least not next. States that I refuse to get licensed in include California. Um, Florida is weird, and some of the East Coast states. And it's just because they have a lot of extra loops. And in order, like if I were to move there, I would do it. But for travel jobs, it just wasn't lucrative enough. It cost too much money. It took up a lot of time. So I wouldn't even be able to get to the travel site in time because they need you to be licensed in that jurisdiction within like 2 months or less. Um, yeah, it's super expensive. And then you have to keep up on CEs. What kind of CEs do they want? Some want 20 a year, some want 30 for 2 years. Sometimes they require 2 or 3 areas be covered in those CEs on top of everything else. And then you're paying $240 versus 80 in another state. So licensure is really confusing. And I don't foresee us ever having like a national licensing because it would upset state boards, and state boards want to have rule over their jurisdictions, rightfully so. But I think they also want the money, and not everyone agrees on what is the basics. So, do we need 4,000 hours for an LCSW, or do we need 32? How many hours of supervision? That kind of stuff. And you'll see that with other licenses too. I'm a licensed addictions counselor candidate as well. And so in the state of Montana, I can get that relatively easy along with my LCSW. That's why I'm doing it. They're allowing the hours to be done at the same time. But in Ohio, the LAC I get in Montana would not be the equivalent to their highest level of addictions counseling there. So I might have to go back and redo stuff. And states do that too. Sometimes they won't count hours. It's not within their time frame. The supervisor you had in their state didn't meet their supervisor requirements. So it's really messy. So for that, I mean, and I tell this to social workers who aren't travelers, if you're graduating and you're going to get licensed, make sure you understand that licensing board's rules and regulations. And stay in contact with them, email them, call them, whatever. I mean, that's what they're there for. They're there to answer questions if they're not putting it on the board. And save up money. It's expensive. And CEs can be expensive if you're not doing like 1 hour here and there for free.
Thank you. We have another question. Where in Montana have you worked?
So I've only worked in one place in Montana, and technically it's not really Montana. I'm on sovereign land. So I'm in Northeast Montana on the Fort Peck Reservation. It's the Assiniboine Sioux. And I've been up here for 16 months. I don't know. I'm just saying that number. It's about a year and a half. Okay, I know where Fort Peck is. Yeah, that's actually my friend lives out there, and that's where the grocery store is that she was talking about. It's a nice one.
Thank you. I'd like to invite the audience now to jump in for questions. I have a question.
Okay.
I was wondering, what's the most challenging community in terms of like, getting there and getting acclimated to maybe a geographical region that you're not used to?
I don't know if this will surprise you or not. This is actually a conversation I had ongoing when I was in the contract with one of my mentors because I didn't quite understand why I was having such a hard time. So I was in a rural, mostly farming area of Minnesota, and everyone there is white. Um, but there were people there who had never left their county. It wasn't a big county. It's not like Maricopa County in Phoenix where it's like a third of the state almost. Like it was a normal sized county in my mind, whatever that means. Um, they were all related through marriage or birth. They were all very close knit, and they were very wonderful people. They were friendly, they were helpful, but they just didn't quite get me. they they didn't understand why I wanted to travel all the time. They didn't understand why I only had one child. That came up quite a bit. Why do you only have one? They, on average, like everyone had two or three kids. Even people my age, like that seemed to be normal to have lots and lots of kids. But it was a farming community too, a very Catholic farming community. I should throw that out there too. So there was a lot of cultural things, like religion too. It was always like, oh, what's your last name? Because they were trying to figure out where I was from in the county. It was easy for the elders to do that. Or they'd be like, "Oh, what's your husband's name?" "Oh, he's not here. He's in Ohio." "Well, how many children do you have?" "Well, I have one." "Oh, when are you gonna have more? You're getting older." Like that kind of stuff. It was really just like, oh my. But that was the hardest job because I didn't ever quite connect the same way that I do in other communities. And also the job was different. It was medical social work, so it wasn't therapy. Um, I didn't make as many friends there as I usually do at travel jobs. Once again, because they were really invested in their community and their family, and they're always doing those things. And I, as an outsider, I'm like, "What's that? You're doing what?" I don't. And I've lived rurally. I know some farming stuff. Like it's not like I was just some inner city person that came in there like, "What is a cow?" It was so different, and I really struggled with them. Like, but we're all white. Shouldn't this be easier? Like, shouldn't I get this? And that was one of those cultural moments where I'm like, oh, yeah, no, they have so many other things going on, and so do I, that's what's making it harder. So I think that expectation, and then realizing I had that expectation, and that was wrong. And so I don't do that. I try not to do that anymore. I may do it a little bit, but I try not to just walk in and be like, oh, we're the same, right? No, we're not. We're not.
Thank you. What has your experience been doing travel work as a queer person?
So I pass as heteronormative, as a heterosexual, and I pass as female. I mean, I'm very femme. There are some things that are a little not as femme, like the way I dress. Some of it is a little more masculine, or it's supposed to look more masculine. And then like my hair is always a bit weird. Like I'm now into shaving just parts of my hair off because I think that's fun. So people, they'll sense I'm different, but I don't think they automatically go to, oh, well, this person's queer. I'm also married to a man. And when I'm on contract, when they're with me, they see that and they know who my husband is. I think I have more difficulties when people realize that he's black. and then I have a biracial child. I also don't push my preferred pronouns in workplaces, nor do I talk about it a lot for safety reasons. And I think that's probably clear to everyone here why. I mean, I have been threatened before. I have had discrimination in workplaces, and they can get away with it. As a traveler, I have even less protections in some ways. Like my agency would never ever do anything to endanger me, and they would pull me from a contract and they would fight it. But in workplaces, especially rural ones or conservative ones, I have to kind of keep quiet, and that's hard. That's hard being me because I'm not a quiet person, and I'm not one to just be like, okay. Um, and then like when I was working in the hospital, a lot of the people I worked with were gay. I worked with a lot of gay men actually, and they just saw me and knew. They're like, ah, you're one of us. I actually had a staff member one day come down with a rainbow pin. And he's like, oh, you need this for your stuff. And I'm like, what? He's like, oh, you know why? And that was fun. Um, just, and I think they picked up on some of the language I was using, some of the things I referenced, because once again, I had been in the community there for a long time. They didn't know me personally from the LGBTQ community in Phoenix, but I knew some stuff and they're like, okay, we're getting that. So I mean, how do you be a queer person in rural conservative areas safely? I've had more issues, like I said, with racial issues than the queer issues, but that's because people assume I'm something that I'm not, and I don't always correct them. And I wish I could say, oh no, I'm always on top of it. No, I have to pick what's safe. And then when you factor in my family, I don't want to make a bigger target on them either because of it. And then I guess I'll go into uh, doing travel social work with a Black husband and a biracial child. Um, it can be really difficult when racism is rampant. And Montana is not a racially diverse thinking. The people in majority are mostly white, despite being on a reservation and there being lots of different tribes here. We've run into some places where we can't actually stop. There's a website that you can look up where there's like, I think it's KKK influence, or like they've been marked as potentially having a lot of hate crime and stuff. Some of them are in Montana, and they're not too far from where we are. We've driven past them or through them. That's hard. Um, Back to Minnesota, I actually tried not to show people pictures of my family because I always wanted to see them, because I had overheard a lot of racial slurs being used by both staff and patients, and it's uncomfortable. And when they realize it, it's uncomfortable, and then they could potentially hurt that rapport. And it's something I have to navigate every time. And it's something I talk to my husband about, especially when he's with me. How are you doing? Do you feel safe? And mostly he's like, oh yeah, no, it's fine. They're just ignoring me. I like it. Like they don't want to look at me. They don't want to be near me. He's like, there's a like this happened last time we went to the grocery store. He's like, yeah, no, it's great. They stay really 6 feet away from me all the time. I love it. They're social distancing, and it's not because of the pandemic, but he's like, it's fine. But yeah, those are some of the unfortunate things you have to think about when you're traveling. And not just for work. I mean, we travel across country because we have to go back to Ohio or we're doing stuff. And there are just some places you don't stop. What other questions?
Yeah, can you talk about two questions for you? Can you talk about the research that you're working on for with your PhD? And then also, we really appreciate all of the candor that you're sharing with us and just, getting this inside scoop getting to see under the hood of what all of the different pieces of what this experience has been for you. And I think so. Research question one, but also would love to hear. You've been doing travel social work for a while now, so what about it? What about that experience is keeping you in it? And what have been some of the positive parts of this really diverse experience that you've had?
So part one, research. So one, I'm getting a DSW, not a PhD. There's a couple of PhDs I think in our chat that just like, no, she's getting a DSW. It's different. So my research is essentially I am asking. Thank you, Jonathan. No judgment. Um, essentially, I am asking travel social workers, because who else am I gonna ask questions to? Uh, how do you follow our code of ethics in relation to cultural awareness? So how do you meet that standard jumping around as much as you do? Some basically pick the same job, like medical case management, and they have certification through, I can't think of the name of the organization. And so they're very, very good at that. Some are therapists and they specialize in like somatic therapy. So like my goal is to be a very good trauma therapist and know several different types of somatic therapies, like EMDR, SE, there's some others, and do year contracts that way. However, I tend to fall in love with places. So like here, this is the longest contract I've ever been in, is 15 months. Normally we do 3 to 6 months, sometimes behavioral health a year. So I really fell in love with not only what I'm doing, but where I'm at. So yeah, that's that whole, well, I'll tell you actually what started me down this rabbit hole. When I enrolled in my DSW program, I was actually doing crisis. So basically what we're all going through now is what I was originally going to study and do my research on is crisis response. And then I had it was my second contract, my first as a therapist on with the Dene, so Northern Arizona. And I had a psychologist come up to me the first week I was there, and he's like, do not continue to colonize like the other therapists have. What? I just like, I understood what he said, but I didn't understand. And he gave me a couple of books. Like he didn't just say that and run away. He gave me some stuff to look at. And then I'm curious, and I have access to an online library still. So I'm like, what is he talking about? And then I started looking at patient charts. And I'm also like, holy shit, what has been going on here? The misdiagnosis, the forms of treatment they were using, even as a newer, like almost a brand new traveler. And I've been in the field for a while, but I'm not going to say I'm an expert in a lot of things. But even I could sit there and go, what is this? Why does everyone have a personality disorder listed, but nothing about trauma or PTSD or any of this? Like just straight on personality disorders. So that started that thought process. Okay, how do I do better than the people I'm following? And I switched what I was doing with my DSW. I actually had to switch tracks and I went to clinical so that it made more sense for my research. And I really just started focusing on that, kind of that cultural awareness. How do I become a better social worker in this moment? How do I become a better social work therapist in this moment? So that's kind of where it came from. And then a lot of my Twitter people kept poking me. They're like, do it on travel social work, do it on travel social work. I'm like, I don't know. And they're like, yeah, do it on travel. I'm like, okay, fine, I'll do it on travel social work. So that's how I got there. I've had a lot of bumps along the way, and then the pandemic didn't make it easier. So hopefully I'll be done in a year. That's my goal, a year. What was the second part?
Yeah, the second part, which you kind of alluded to some of it actually already, but was just about, given all of these different experiences, different contexts you've worked in, just what is it that's keeping you in the travel social work space? Why is that? Why is this space still so compelling to you? What are the beneficial things maybe that you're getting out of it?
My personality, I think, is a big component. I am very curious. That's like one word my parents used to describe me as a child. Always curious, always had to know why. And so that curiosity makes me want to learn and experience more. And I always wanted to travel even when I was little, like really young. I want to get on a motorcycle and travel all over the United States all the time. I want to go to Europe. I want to meet people. I want to see things. And so travel work has really satiated that desire to keep moving, to keep going, to keep seeing, to keep learning. Um, it's it's forcing me to do it. It's challenging me, and I get bored. I get super bored and lazy and complacent with shit, and I can't be that person. So traveling really helped with that. That's one part of it. That's more of the um, happy, fluffy social work answer to that. The other answer is I get paid a lot. I make more money doing this than I do working at an inpatient facility in Columbus, Ohio. I can't live off that. However, I can maintain two homes and a certain lifestyle traveling. That's what started it. Um, I am a lot more financially stable now than I was 3 years ago. I mean, we're both employed, we're both getting a lot of experience. Everything I learn and everything I do only makes me a better social worker and a better person in general. And I get to meet new people. So that's the second part. I'm not just doing it for the money though. There are people who do things just for the money. And I want to say I'm not that person. That is what keeps me going though, because it is expensive. Um, what else? Did I miss anything in that?
No, I think, yeah, you covered it, Jay. We have just a few minutes left, y'all. If anyone else wants to unmute themselves and ask Jay a question or put it in the chat before we close out. And we're so grateful to have all of your expertise and insights and candor with us today. So thank you again. But if anyone has final questions, please unmute or put it in the chat.
Come on, Courtney. You got something. Oh, she can't unmute herself.
Try again. But I see in the meantime, we have another question. Before the pandemic, on average, how long were you away from your family?
Um, I think the longest I ever went was 9 weeks. I tried not to go longer than 5 or 6 weeks because my son was young. I mean, he's still young. Uh, but here's a fun thing about doing rural travel work. You're never near an airport, and I refuse to fly in those little planes. Like, yes, there are the little airports, but those little ones scare me. I can't. So I have to drive 2 to 4 hours to a international or a large enough airport to get home. So it really takes almost a day to travel somewhere and then a day to travel back. And then you still have to fly. So like now where I am, I have to go to Billings usually to fly out. That's 4.5 hours. So I have to take a day off just to get to the airport. And it's usually a super early morning flight too. So it's like 2 days of travel just to get somewhere. And then I can't really stay anywhere too long. And then I have to fly back. So traveling like home was really difficult sometimes. Um, Now, I mean, my family, I had to warn them prior. I'm like, if I just lose my train of thought and start staring off to the distance, it's because I'm glaring at my door, because my partner and my 5-year-old are arguing about stuff because we've been stuck in this house together for a couple days with no reprieve. Hi, Courtney.
Hi, Jay. Thanks so much for everything. It's been great hearing the story. So one of the questions, and I'm sure we've spoken briefly about this in the past, is, I always look, what are we teaching to students, and what can we offer them who might not realize that certain things are out there in social work, because they have this image of social work in their minds, or they have a very particular track in their school that they follow. So what, in the years that you've been doing this, and I'm sure the fun times and areas that you've been in, what do you think is the kind of one thing that you would say to students to keep in mind of things you wish you knew before you going into it, uh, that they could take while they're thinking about their social work careers and where to go from there?
What the possibilities are endless. I mean, Courtney, you also have kind of gone down an alt track too. You know, Courtney and I have both followed what we love. And it has taken us to so many wonderful. Are you in Scotland right now?
I am. I'm actually on the opposite side.
There
So
we go.
I'm in Edinburgh right now.
See, her path took her to Scotland, which I still need to visit when there's not a pandemic. But we are doing what we love. Like I said earlier, I love to travel. I love to meet new people. I love to learn new skills. What fits that? Well, traveling. Well, is there such a thing in social work? Yeah, there is. So you can do it. If you want to do more macro work, so working at agency levels, you can do that. You don't necessarily, like, even if you did a clinical track in your BSW, or I'm sorry, MSW, or what, I don't have a BSW. I'm not actually sure what that looks like. I know it's more of the foundational stuff, but if you do that in your master's, that doesn't mean you're stuck in it. You can do other things. Maybe you find out that you really like grant writing and you want to become a grant writer, and like you're the best grant writer ever, and then you become a contractor and you are making $100,000 a year. And by the way, that was a story I heard while I was getting my MSW. A gentleman came in from the community, and that's what he ended up doing. And he wrote for a lot of the LGBTQ organizations in the area. I have other MSW friends who are very political, and so they sit on a lot of boards and they do a lot of amazing work. And then I have clinical friends who are absolutely doing the work in the street. They are still crisis response. They're still literally working in the street. Like, I've worked for the fire department, I've worked for crisis response teams in the community. So we're getting called to people's homes. I've literally been in the field assessing someone next to a dead calf. I've worked in long-term care. I've worked in hospitals. I've stood in a trauma bay while we had 4 or 5 people come in with GSWs, gunshot wounds. And then I've been on beautiful sovereign nations, seeing things that I didn't ever think I'd be able to see, hearing languages that I honestly, I didn't know up until that moment were still being spoken. And that was my ignorance. And I've tried to educate myself on it. But what do you want to do? Where do you see yourself? Or where would you want to see yourself? And then be flexible. It might not work out that way. And that's okay. Do you have anything to add, Courtney? I love Courtney, by the way. She's amazing.
Well, I have to go out on that high note. I can't ask anything else. No, I think I agree with you 100%. I think that we don't want to put social work in a box, and social work is wonderful because we don't put it in boxes. And I think your talk today is kind of exemplifying just how to unpack social work in any way that you can. And it really is following passions and pathways. And it doesn't matter if you're the first one, just get in there and do it. And I think that's great.
Wonder. I think we have time for one more question. If I talk fast, I think they're done. They're like, all right, it's almost 1. We're done, guys.
Yeah,
Or
well,
2. I'm sorry. I'm in a different time zone.
we know what you mean. Linda, do you have a question? Okay, I'll unmute you.
Hi, so I don't really have a question, but I just wanted to thank the Donito Center and Jennifer and Sarah for putting this together, and Jay for sharing their story with us. You know, I know you from Twitter, and the article that you wrote for the new social worker, of course, which I hope everybody will read, because you really did a great job in that article of not just describing the work that you do, but the love of the travel. I love that. And I just love hearing about all different areas of social work, because there's so many of them. And I think it's really great when people can find sort of that niche that just fits. So, you know, I think that comes through and what you've talked about today, Jay. So that's pretty much what I wanted to say.
Thank
Thank
you.
you for this.
And I guess I'll just add, for everyone who's thinking about what I've said, I'm sure you're gonna have more questions later. So if you have Twitter, find me. You can, my DMs are open. I don't close them. If you have Instagram, and I think a lot of you are following me on Instagram, because I got just a huge amount of people following me like in the last 2 days, and a lot of them were students. So once again, that's open too. I get a lot of messages that way. I also have a website. It's travelmsw.com. Do you see a theme? You can actually email me through that. It'll go to my email, and I can respond back. Otherwise, that's all I have. I mean, I appreciate everyone coming out. I appreciate the representation across the United States. Thank you, Linda, Courtney. I know Jonathan already left. Thank you for coming. I know some people want to watch this later too. They were like, oh, good, it's on YouTube. So I will share that with them.
Awesome. Well, Jay, thank you so much again. We loved having you as our guest. This was just such a insightful and inspiring conversation, and we so much appreciate you know, just the generosity of your spirit, your candor, and all the insights you have to share with us and the students here. So thank you one more time. And you know, from all the, I'll just sign off for everyone from the Data Center. You know, thank you all for joining us, and thank you, Jay, so much for being such a wonderful host. So everyone, take care, and hopefully we will see you all soon.
Bye.